Hi, everyone. Thanks for joining. I'm excited to tell you about our NASA HACAS project entitled Supporting Health Impact Assessment Tools Using Remote Sensing and Earth System Models. Here I've listed on this slide a lot of our collaborators, our stakeholders, as well as co-investigators in this project who will be presenting along with me during the course of this presentation. So this video is going to begin with an explanation and introduction to the Climate and Clean Air Coalition for myself. Then I'm going to hand things over to Charlie Heaps. He is the developer of LEAP, and he's going to show us the LEAP IBC tool. Next, I will turn things over to stakeholders, Andriana Mbandi and Stephanie Penn, who have been involved in applications of LEAP IBC in Africa. Lastly, we'll review some of the activities carried out through Tiger teams, and we'll directly hear from the co-investigators of this HACAS team, Susan Annenberg and Patrick Kinney, regarding the Tiger team project that they led. The Climate and Clean Air Coalition was initiated in 2012, and it now includes over 69 member countries and 77 NGOs. The CCAC is responsible for multiple cross-cutting initiatives whose main goal is to reduce emissions of short-lived climate pollutants, or SLCPs. These include emissions of aerosols, aerosol precursor species, short-lived greenhouse gases, or their precursor emissions. The CCAC contributes to funding for national action plans submitted by member nations to reduce emissions of these species. To help with the planning that goes into developing a national action plan, the CCAC then provides SNAP toolkits. So these are planning tools that allow the member nations to develop strategies for reducing their emissions of SLCPs. Here I'll be presenting LEAP IBC, which is one of these SNAP toolkits. LEAP is an energy scenario planning tool that allows people to look at the impacts of different mitigation or policy measures on changes in emissions. Our project added to that the integrated benefits calculator, which allows planners to look at how changes in emissions impact the response of atmospheric constituents and how the change in these atmospheric constituents impacts endpoints like human health, climate, or ecosystems. The tool needed to be kind of a generic thing that could be applied to many countries around the world. So this part that we're adding here, the IBC, calculates country-specific responses for arbitrary levels of emissions anywhere in the world. LEAP IBC has been used by more than 25 CCAC member nations. Some of the more active members listed here include Peru, Colombia, Mexico, Chile, Ghana, Bangladesh, Togo, and Nigeria. So one of the main goals of the Integrated Benefits Calculator is to provide estimates of how emissions changes impact PM2.5 exposure and the associated health impacts. Because the members of the CCAC and the users of LEAP IBC are countries and cities and organizations spread all around the world, we needed a globally consistent method for estimating PM2.5 exposure. Models can estimate this directly, but they have difficulties in estimating exposure owing to their coarse resolution when they're run at global scales. This is really then where we can take advantage of satellite-based estimates of PM2.5, such as the one shown on the right here from Aaron van Dunkelaar that uses AOD measured by MODIS, MISR, and CWIFs, and aerosol extinction vertical profiles from Calliope, as well as modeled relationships between AOD and surface PM concentrations to develop these high-resolution maps. We then take these maps and assimilate them into our model calculations to both downscale our estimated PM2.5 to a higher spatial resolution and also bias correct our model where we're seeing significant differences between our purely model-based estimates and this kind of observationally constrained value of PM2.5. Another component of the IBC is estimating the climate impacts of these short-lived climate pollutant emissions. One of the mechanisms for changing climate is the impact of ozone on outgoing long-wave radiation. This is actually a product that is measured by the TESS satellite instrument. So we use these satellite observations of the sensitivity of outgoing long-wave radiation to ozone. Then we propagate that information through a source apportionment calculation to the contributions from ozone precursor emissions, NOx, CO, and VOCs. We also include the radiative forcing impacts of methane and aerosols, and these are direct model simulations. We translate impacts of radiative forcing into changes in temperature based on parameterized output from a series of modeling experiments performed with the NASA GIST model. Temperature change is calculated as a transient function for both the short-lived species and long-lived species like CO2. Finally, a key component of making IBC work is source apportionment calculations that we perform with the GeoChem adjoint model. This model is run for each of these impacts, PM2.5 and ozone exposure, as well as ozone crop impacts, which we didn't talk too much about here, in each country, and then ozone and aerosol radiative forcing in 4 latitude bands. This apportionment calculation provides us the per emission impact from each species, sector, and location in our model. That means we can say, here's the impact of a NOx emission from transportation over here in this country, and compare that to the impact of a black carbon emission from residential sector in this other location. This heterogeneous distribution of the marginal impacts of emissions on these different endpoints can then be multiplied offline by projected changes in emissions. That's how the IBC works. Rapidly, all of the atmospheric transport calculations have been done ahead of time. What we save from that is the source apportionment calculation that can then be combined with changes in emissions. To develop all of these source apportionment coefficients required over 1 million CPU hours on supercomputers, but we've managed to distill that down into an easily usable decision support toolkit.
Hello, my name is Charlie Heaps and I'm a senior scientist at the Stockholm Environment Institute, and I'm lead developer of LEAP, the Low Emissions Analysis Platform. Over the past 5 years, SEI has been working with the Climate and Clean Air Coalition, the US Environmental Protection Agency, and researchers such as Daven Henze at the University of Colorado to develop a new part of LEAP called IBC, the Integrated Benefits Calculator. IBC is designed to help examine the health, crop, and climate impacts of future energy and emissions pathways. The tool is particularly focused on the needs of planners working in developing countries, and particularly those in national ministries of environment and energy. Today, I want to give you a brief introduction to some of the theory behind LEAP and IBC, and to show you how they actually work together in practice. I will start off with a few slides, and then we will switch over to show LEAP IBC in operation. First of all, what is LEAP? LEAP is a Windows-based platform for energy, climate mitigation, and air pollution abatement planning, which has been developed over the last 30 years by the Stockholm Environment Institute. LEAP has been widely applied in over 190 countries. At least 38 used it to help develop their nationally developed contributions to the Paris Climate Agreement, the NDCs. LEAP is a scenario-based modeling tool that explores how emissions may change in the future under alternative policy settings, for example, a baseline or a low-emission development scenario. IBC, the Integrated Benefits Calculator, is a new part of LEAP. IBC calculates health, crop, and climate impacts from emission pathways calculated in LEAP. IBC currently works at the national scale for about 120 countries, with more coming soon, plus an additional new version that will work at the urban scale. You can see the LEAP IBC modeling pathway visualized on this slide. The transport modeling takes the emissions from LEAP and calculates population-weighted concentrations based on the GeoChem adjoint modeling, and then health impacts are calculated based on the relative risk functions from the Global Burden of Disease study. Here we are showing emissions of PM2.5 particulates over time, which were calculated in LEAP within the sectoral structure shown in the tree on the left. You can see that emissions more than double, with big growth coming in particular from a rapidly growing transport sector. Other major sources of emissions include the residential, charcoal making, electric generation, and agriculture sectors. Now let's turn to the calculations done by IBC. The results of IBC calculations are all produced back in LEAP and can be examined under these branches called the indicator branches. Let's look at the premature mortality results. These are growing more rapidly than emissions, growing by a factor of 3 rather than a factor of 2 for emissions. Why is that? Well, in part it's because the population is growing, so there are more people around to breathe in any polluted air. But it is also because this is a country that is expected to get significantly older by 2050, making people more susceptible to the diseases caused by air pollution. So here we are looking at the results for the integrated strategy scenario. You can see that there's dramatic reduction in emissions. More than 3/4 of the emissions are avoided relative to the baseline scenario. LEAP has some very nice ways of visualizing scenario results. Here, the dotted line shows you what you've avoided from one scenario versus another. Unfortunately, the picture is not quite so rosy when we look at mortality. Only about 15% of premature mortality is avoided in 2050. This is largely due to aging populations and the stable emissions coming from other countries and the natural background. But it's also due to the exposures occurring, which are occurring mainly on the relatively flat part of the relative risk curves coming from the Global Burden of Disease study.
So I hope that gave you a quick sense of what LEAP IBC actually looks like and how it works. It's been used by more than 25 countries for developing their SLCP national action plans. Several of those are now published and available. You can view the links here, and I'm showing you the cover of the one for Nigeria. As well as contributing to national action plans, the availability of air pollution as a consideration in this type of energy planning also promoted the consideration of species like black carbon within the nationally determined contributions for countries such as Chile and Mongolia. LEAP IBC itself has also been used in other CCAC assessments for Latin America, Africa, and Asia, and the EPA Megacities project. Next, I'm going to turn things over to stakeholders who have been more directly involved with the application of LEAP IBC and satellite-based estimates of air pollutants in Africa.
Okay, my name is Andrea Nambandi. I work on air quality research in Africa, and I'm currently based in Nairobi. This is a regional assessment, which is a regional assessment, Climate and Clean Air Coalition regional assessment. They have done one for Latin America and recently one for Asia. And now this is the time they're starting the assessment for Africa. It is the first time that LEAP IBC will be used at this scale. We're basically looking at doing, building up inventories for up to 30 countries, national inventories using the LEAP IBC tool. And then from there, build it all together into a model to assess the scale at which air pollution is impacting on climate change, that is impacting on health, human health, and also impacting on crop yield. So the data gap for air quality information in Africa is huge. And unfortunately, for the last few years I've been involved in this work, I don't see that gap lessening. But we're talking about ground monitoring data. And in this case, a lot of the information coming back to us is normally from government agencies. A lot of these government agencies don't have the capacity to do any kind of air quality monitoring, ground air quality monitoring, ambient for that matter. So I think what I've experienced is a few government agencies through different efforts for capacity building, through partnerships such as the one that you have with NASA, are starting to have knowledge of satellite data. Now, its utility really in their terms of enforcement and compliance is not something that they yet understand, but they can see the possibility of the utility in planning. But again, I think the answer lies in, for them to see utility, they will have, it has to be within their legislative geography, so to speak. So if their national government and the satellite data is available for air quality at the national scale, then that's something they can use for planning. But in terms of enforcement and compliance, where you need to understand where the hotspots are in terms of targeting interventions, then they don't see that satellite data has information has reached to that scale. So the answer is, I think, capacity building, because then it alerts, or at least they get to know about this utility for the satellite data. So that the answer is not always that there is no data, because normally that's what you're told when you inquire about enforcement and compliance where air quality management is concerned. But once that gap has been bridged, then it's the utility in which they can use this data that it still needs to be answered for them. Botswana has about 20 air quality monitoring stations for a very small country. Nairobi has none, and Ethiopia has at least 2 from the US Embassy and the International School, and at least 1 more from another research consortia. So given that it was such a small investment in terms of training and capacity, and where that was able to reach, I would say we cannot stress more about the capacity building as a low-hanging fruit. And there's need for capacity training. We get requests all the time. We're not even able to answer to that. So in Kenya, and I think Kenya, Ethiopia, Uganda, Rwanda, in fact, surprisingly, it's been a lot of users from the Ministry of Energy, and then the Ministry of Environment, especially the Climate Change Directorate. Those are very good entry points because they are already a core group with a greenhouse gas inventory. So adding on to short-lived climate pollutants and air pollutants is not such a big, it's not a big reach. So you're finding a core group already targeted, already trained for greenhouse gas inventory, and then you're adding on to everything else that LEAP IBC has capabilities for.
I'm Stephanie Penn. I have a PhD in environmental health, and I do air quality management and exposure assessment and health benefits analysis work at Industrial Economics. We're an environmental economics firm based in Cambridge, Massachusetts. IEC has been working with the US EPA in support of their megacities partnerships in both Africa and in South America. One of the projects specifically is in Addis Ababa, Ethiopia, where we have provided capacity building and air quality management planning guidance to the City Level Environmental Protection Authority, or City Level Environmental Protection Commission. Remote sensing data has been very helpful and really a key piece of us being able to move forward. So many of the developing cities that we work in tend to be data sparse environments, but we've been able to leverage the remote sensing or satellite data to understand, in this case, the discussion of the Addis Ababa work, the fine particulate matter surface across the city. So it allowed us to understand the baseline health burden associated with air pollution and provide a real basis for the local institutions to take action, and also provide some information for the local organizations to be able to share with potential donors to help them make air quality management improvements going forward. So here we can see the satellite-based measurements of PM2.5 concentrations in 2017 on the left-hand side for PM2.5, and you can see them a range of concentrations across the city. What I don't show here is the roadways within the city, but the concentrations are higher in areas where you would expect, given local activity. We were able to use that information in conjunction with local health data collected by the Addis Ababa City Health Bureau and local population data to understand the count of non-accidental deaths by WREDA associated with the current air quality burden. And then we're able to do some estimated calculations of projected concentrations with no air quality controls or air quality management strategies put into place, to then understand how this would impact the deaths by non-accidental deaths by woreda in the future. Addis Ababa is at a position, at a point in time where they have the opportunity to make some big changes to impact air quality, and these information are very motivating to them. Our relationship with the LEAP IBC tool has largely been in helping to guide and provide funding to expand the abilities of LEAP IBC to broaden the number of cities and countries where they're able to create emissions inventories and then eventual calculation of the impacts associated with emissions in those locations, but also to help to determine which areas are important and where to go next. I guess since I started doing this type of work almost 6 years ago, the satellite-based data was not nearly as widely available then, and it's really helped us to be able to do capacity building and have just more confidence in the information that we're sharing with the organizations that we're working with. So it's made quite a difference in that short amount of time. The fact that EPA has been able to continue doing this work over the last number of years has been really exciting.
So as you heard in the descriptions of the current applications of LEAP IBC, a lot of these projects are still ongoing. And I think a major success of our HACAST work is that the stakeholders, SEI and EPA via industrial economics, are continuing to support financially and also develop and apply this tool. The International Council on Clean Transportation is very interested in also being able to rapidly estimate the impacts of changes in transportation emissions on PM2.5 ozone-related health impacts. And so this is a tool that we're continuing to develop with support from the ICCT. I also wanted to mention some additional highlights and outcomes of our core HACAST research. We use this tool in our own research group to quantify the health and climate impacts of emissions mitigation from cook stoves. In a paper from Forrest, Lacey, and PNAS in 2017, a figure which is shown on the right, where you see the contributions to global premature mortalities owing to the residential cook stove emissions from different species in different countries of the world. We also use modeling results to reevaluate the global burden of disease associated with long-term exposure to ozone, suggesting that it could be 2 to 4 times larger than previously considered. In a study led by Susan Annenberg, we used our satellite-constrained model simulations to quantify the health and climate impacts of fugitive diesel NOx emissions. Again, using our satellite-constrained estimates of PM2.5 combined with model simulations. In a study led by Chris Malley, we looked at the first global assessment of the premature births associated with long-term exposure to PM2.5. We also contributed to many publications evaluating long-range pollutant transport and associated health impacts as part of the HTAP, Hemispheric Transport of Atmospheric Pollutants project supported by the UN's LURTAP convention. Next, I want to turn things over to our co-investigators, Susan Annenberg and Pat Kinney. They will tell you about the Tiger Team activities that they led on air pollution indicators at high resolution PM2.5. As part of HACAST, we also contributed to many other Tiger Team activities led by other HACAST PIs. A lot of our work revolved around using NO2 and SO2 observations from OMI to constrain NOx emissions. This contributed to projects looking at improved air quality forecasting, looking at providing information to SIPs, and looking at evaluation of background ozone, regional haze, and trends in air quality indicators. We also use these results to help evaluate ozone exceedances in Yuma, Arizona. And lastly, Pat Kinney was a co-I of the Tiger Team activity led by Susan O'Neill, evaluating the health impacts of fires.
I'm Susan Annenberg from the George Washington University Milken Institute School of Public Health. First, here I'm showing PM2.5 mortality in 250 cities worldwide. And this is really the first snapshot that we've had of the health impacts of air pollution across hundreds of cities on a worldwide basis in a manner that is globally consistent and compatible with the Global Burden of Disease study. You can see here that the bubbles are largest in some of the most populated cities of the world, in China and in India. And those bubbles, the size of the bubbles correspond to the total PM2.5 mortality occurring in these cities. But what we found that was interesting was that PM2.5 attributable mortality rates, that is per 100,000 people, ranged by a factor of 10 worldwide. So what this indicates is that some cities are doing much better than other cities in terms of lowering their PM2.5 mortality. Another interesting thing that we found in this study was that there was a different pattern between PM2.5 concentrations and PM2.5 death rates, where the total PM2.5 death rates did not necessarily follow the ranking of cities in terms of PM2.5 concentration. So what this tells us is that it is important to take into account both the exposure levels and the baseline health status and population of the local area to understand the health impacts driven by air pollution. We published a paper on this in Scientific Reports last year in 2019. And the results are being used by several different stakeholders, one of which is C40 Cities, who really wants to know, for cities who are making major investments in getting to carbon neutrality, what would be the local air quality and public health co-benefits of those investments in carbon neutrality? And here we are providing them a baseline to understand the current levels of PM2.5 mortality in all cities worldwide that they can use to assess the health benefits of reducing air pollution. A similar study we did was with a stakeholder called the International Council on Clean Transportation, or ICCT. They are an independent analytical organization that provides analysis and advice on transportation emission regulations for countries all over the world. And for this stakeholder, they were interested in understanding what is the total burden of disease from air pollution that comes from transportation tailpipe emissions. So we did this analysis estimating the global burden of transportation tailpipe emissions on air pollution related mortality in 2010 and 2015, using satellite observations of aerosol optical depth to understand how 2.5 levels vary within the very large grid cells of global scale chemical transport models. And as a result of being able to use these AOD observations, we have estimates of PM2.5 concentrations that are attributable to transportation tailpipe emissions at fine enough scales that we can resolve what's going on in cities. So this is just a snapshot of the PM2.5 and ozone-related premature deaths in 2015 by urban area, looking at, again, at hundreds of urban areas around the world. The size of the bubbles shows the total magnitude of transport attributable PM2.5 and ozone deaths. And again, here we see that the largest bubbles are in some of the most populous cities of the world. But the color of the bubble shows the transportation attributable fraction. That is the fraction of air pollution related mortality that's attributed to transportation tailpipe emissions. And here we see that the red colors in Europe and in Mexico City, these are cities where the largest fraction of ambient air pollution related mortality is coming from transportation. And it indicates that in these locations, other sources of emissions have largely been reduced, so that transportation is still a very significant contributing source to air pollution related mortality. The results that I've shown thus far are looking at the total air pollution related mortality across entire cities, and it doesn't show us what's going on within the city. So the HACAST high resolution Tiger team developed new data sets using satellite observations of aerosol optical depth to understand the differential exposure of PM 2.5 within individual cities. And we took that the next step to say, you know, with this differential exposure by neighborhood within city, we also know that there are pretty dramatic health disparities within cities. So can we take information both about the spatial distribution of pollution levels and the spatial distribution of baseline disease rates and bring them together and try to understand which neighborhoods might be experiencing hotspots of very high air pollution related health risks. And we did this for 4 cities, Boston, New York City, Los Angeles, and Washington, DC, for 4 health outcomes: asthma emergency department visits, chronic obstructive pulmonary disease, lung cancer, and stroke. And here we found that there were neighborhoods that had very high air pollution related health risks, much higher than some of the neighboring areas within the city. We are still working directly with some of the city health and environment departments to understand these results and sort of iterate on them to make sure that we're using the the best possible data sources, both for pollution levels and for disease rates. But this type of information can be quite useful for city decision makers to understand, which neighborhoods might be experiencing greater risk from air pollution and where might they devote resources to bring down air pollution levels.
Hi, I'm Pat Kinney. I'm a professor at Boston University School of Public Health, and I've been part of Daven's HACAST team for the last 4 years, along with Susan Annenberg. The work I've done has, well, historically, I've been doing a lot of work on the health effects of air pollution, and I've been really interested in understanding how NASA products can be used to help us develop higher resolution estimates of air pollution in cities. So I'd like to talk about a project that was developed as a Tiger team during my work with Daven, which examines the use of high resolution particulate matter for health impact assessments in cities. So there's really a need from a health assessment perspective to have higher resolution data, particularly on PM 2.5 over long-term averages, which is the exposure that's of most risk as we currently understand it. There's been a lot of interest in low-cost sensors as a way of getting at that, but unfortunately, a lot of the available real-time sensors are really not optimal for long-term sampling because of calibration issues and humidity interferences. Now, passive samplers have potential to sort of fill that gap. They haven't really been used too much for particles, and they certainly haven't been really validated for PM 2.5. So my project was really aimed at trying to do just that. So we set up some passive samplers. This shows you some samplers that we set up in the Boston area. And we co-located them with both federal equivalent and federal reference methods. And we see, so we had 8 sites in Boston, San Francisco, and in New York City. We ran them for a year, and we computed the annual average of monthly samples that we collected passively against the annual average collected from the sort of standard high cost methods. The left plot is showing our data plotted against the federal equivalent method, which is the real-time method, that's the BAM method that's used by the EPA. And on the right, we had fewer filter samples to co-locate, unfortunately, because of some missing data on the filter side, but also showing the correlation. And these correlations are on the order of 0.6 to 0.8, which is, I think, pretty good for a first effort, suggesting that a passive sampler collected sequentially, for a month or 2 months at a time can actually fill an important gap in long-term sampling. And I just wanted to mention that this project, like so many of the other HACAST Tiger teams, involved a very large multidisciplinary team of co-investigators, which some of which are shown on the slide. Thank you. Yeah, why low-cost sensors? Like, how do they fit into the NASA remote sensing context? But it's really yeah, the fused products where you use low-cost sensors to calibrate at fine scales, using land use and other variables along with remote sensing.
So that's all we have for you folks. Thank you for your attention. If you have any questions or would like to follow up about any of these topics, here's our contact information, and thank you for your time.